So, Andy, you've been working on a report for the last 18 months or so.
Yes.
For the Royal Free Charity, looking at the future of healthcare in the digital era with a 10 to 15 year horizon as a provocation and to explore a vision for a future of healthcare. Can you just explain to us a bit more about the report and what some of the key findings may have been?
Yes, certainly. It's quite unusual to have a brief to look at a report in a 10 to 15 year time horizon. But the Royal Free Charity were quite forward thinking and inspirational in that regard. And why did they ask for a report for 10 to 15 years? Well, the answer is there is huge transformational changes happening in the healthcare system. At the moment, it's recognised that we have a very siloed healthcare system, hospitals, silos within hospitals, primary care, social care, public health. And there's a real recognition that if we're going to get on top of healthcare for the 21st century and improve levels of health and well-being, those actors need to start to work together. We need to start looking at health more holistically. Layered on top of that challenge of how might we do that, we're about to face the biggest changes in medicine and technology that humanity has ever seen, normally called Industry 4.0. This really reflects a whole series of breakthroughs on genetic medicine, the development of a whole range of new sensors to measure things we currently don't measure. And coming out of that, of course, is a world of huge amounts and a huge explosion of data. So what does all this mean? How do we measure? How do we track? How do we understand the environment in which health is looked at? So it was interesting in this report that instead of taking an institutional frame to look at this challenge, i.e. what's the future of hospitals, what's the future of primary care, the frame we chose to look through at this challenge is health for the individual. Because all this technology and all this capability is essentially understanding in much more detail what it is that health is and what are the things that impact it and what are the potential interventions that might support and help people to live more healthily, to flourish, but also to manage with disease and loss of function should that happen. So what we've laid out in this report is really what we call a cells to cities framework, saying health isn't just the clinical medical frame of what goes on in your body, as important as that is, and there's more we will understand about that. But health is also perhaps more influenced by health behaviours, what we eat, drink, our levels of stress and exercise, the social context in which those behaviours happen, and there's lots been understood now about the social determinants. And further beyond that, the environmental context in which all of that happens. We know that all those factors relate to health, but that typically they've been looked at quite independently as separate pieces of a jigsaw that's never been put together. So in this 10 to 15 year report, we basically roll forward all the trends that we're seeing to imagine if all of those trends have landed at scale and we could see this picture in its totality, what could healthcare look like for the individual? And what would that mean for the actors that are involved in supporting health? From public health and clinical health, but also looking at the other realm of actors that are involved in health and healthy outcomes. And that brings into play non-clinical actors as well. So that's public health, local government, but also brings in other industries, and also I think the importance of work and the environment in which we live in, because health is a result of those contexts as well. So in this report we talk about that future, the expanded set of actors with a much expanded set of data and insight to see how all these factors coalesce together, to see how at an individual level and a population level, what is happening, what are the factors that affect health, and how might that inform much more inspired, enlightened support from both official healthcare systems, but also other actors working around a common understanding of the health challenge.
Okay, and the findings seem to suggest that what's required is really a transformation in the way we even think about the system, because the system was developed at the height of the industrial era. Really, it sounds like what you're describing is a kind of post-industrial era healthcare system, and it's more focused on health than on care and treatment.
Yes, I think that's fair to say. I mean, a lot of commentators have characterized our approach to health as having a 19th century model of medical care layered on top of a 20th century industrial model of institutional factory production line, faced with a 21st century challenge of the burden of healthcare largely having moved to chronic disease, which is an ongoing management of a lifelong conditions, and the importance of prevention with a whole range of new technologies. So coming at this through the institutional silos that we erected in the 20th century, they had their time, they had their place, but they're no longer the most appropriate ways of addressing the healthcare challenge. As many, many commentators have said, what we've ended up doing is creating lots of different silos, running in almost like a factory production line where essentially people who are sick, let's call them patients, have to wrap themselves around these silos, rather than in a 21st century model, which we're outlining, the health resources need to wrap themselves around the individual if we're going to have maximum impact in both preventing, supporting and managing people through either avoiding disease or managing if they get it.
So the opportunity is to use new technologies to allow the individual to take more control of their own well-being and healthcare if they get into a situation of illness, but also to enable other actors like the workplace and employers to manage better the well-being of their employees as well. That wasn't possible before the new technologies, presumably.
It was less difficult because health is a complex landscape, and many of the pieces of it that we knew were in play and that were affecting, it was very difficult to see what was going on, to measure. And without that data, without that being able to, in a more granular way, see the nature of the interlinking causal factors, it was very difficult to know what kind of interventions to undertake and how to make that far more precise. I think in this future world where essentially there's going to be, if we could characterize it as sensors probably in the body, on the body, around the body, and in the contexts in which people live their lives, there's rich sources of data that will reveal not only biologically how you are, but be able to undertake a much more granular understanding of the behaviors and the context that lead to those behaviors. So we'll get a much more detailed picture, which will essentially help both individuals to understand what is going on within their own health and the relationships and links between what they're doing and what the outcomes are. So I think that's part of this transformation of passive people today dealing with sort of paternal advice from institutions to something where people have much more detailed information about themselves to facilitate a sort of greater self-ownership, if you like, of more aspects of their health and well-being. But this data is also going to be extremely valuable for those actors who play a part in that greater picture. And health and well-being at work, I think, will be revolutionized by this, because we'll be able to undertake greater depth and understanding of the context, the environments, the stresses and strains of the workplace and its relationship to mental and physical health outcomes.
And so it's always been a very complex system, but you've taken a very holistic view of the system and all of the actors within the system, which actually, in a way, makes it even more complex. But with the capture of all of the data and the use of technology, you're expecting that technology will help get our heads around all of that complexity and empower each of the different actors to play their individual parts in the whole process, rather than it all being left to the healthcare system itself.
Yes, unavoidably, I mean, health and well-being is a complex space, and we can't avoid understanding that. And as we've been talking about, traditionally and historically, we've taken pieces of that, and institutions have looked after pieces of that healthcare landscape. But if we're truly to think about how we get on top of health and well-being and how we more effectively transform a society that at the moment is facing an epidemic, a crisis of poor health and chronic disease. We need to get our arms around, if you like, the more holistic picture and figure out how to do that. One of the really great responses we've had to this piece of work is twofold. One is a sense from across the healthcare and the non-healthcare actors that there hasn't been a piece of work that's really looked this 10 to 15 year distance out. Most strategy work is 0 to 5 years at best and probably 0 to 3 years. And within that frame, there's a sense in which the individual actors are thinking incrementally what can they do to improve what they're offering and how they can incrementally innovate from where they are now. That misses the bigger picture, and it also misses the fact that these transformational changes in technology and medicine are going to land in this 10 to 15 year time frame. So bringing that longer term frame enables us to see not only what isn't working now, but what are the new tools and new capabilities that allow us to rethink how we address health and well-being. So this 10 to 15 year frame has proved quite exciting to people who've read this report. And secondly, the fact that we, as you've indicated, we've got our arms around multiple trends to bring them together in a more sort of systems thinking way about what that would look like. And yes, it is complex. And one of the paradoxes, if you like, one of the challenges we've got here is that as science and technology reveals in an ever more granular nature all these elements, all these factors, how do we bring them together and synthesize that into something that's understandable and meaningful for the actors involved in it and for the individuals who are going to need to take more responsibility. So technology is not only revealing more, but it also needs to play a role in that act of synthesis and pulling together. So some of the machine learning and AI is going to be absolutely central to that.
So the report itself is called Healthcare Beyond the Fog. The fog that you're talking about is as a result of all of the complexity and the silos and the fact that nobody's able to see the whole picture. Is that?
Yes. One of the interesting observations of talking to many leaders across this field is that in looking through the frame of their particular institution, there's quite a narrow sense of where the future is if you incrementally look forward from where you are from your particular piece of this landscape. What was missing from the entire health and well-being arena was a sense of if all these trends, if you were to roll them forward, what would it enable a new health ecosystem to look like? So in the absence of a long-term vision that all actors could work towards, which is what we're trying to build here, there was a sense that lots of people very motivated, trying to do the right thing, but there is lack of coordination, understanding where everyone is going and how the whole could become greater than the sum of the parts. And it's only through addressing that whole question that we think that there is a real opportunity to address the epidemic of ill health and chronic disease which now besets our country.
So looking at this specifically in relation to the workplace, a number of employers believe that they do play a role in being concerned about employee well-being and healthcare. They tend to look at schemes that actually are about changing the behaviours of the employee, because it's those kind of behaviours that lead to bad healthcare or well-being outcomes. But are employers in doing that looking at the symptoms or passing the blame or the responsibility to the individual, given the fact that the workplace is a large cause of stress, and stress is a large cause of many of those problematic behaviours?
It's a good question, and one of the things we talk about in the report is that if we're talking about the context in which health and well-being is manifested, work is a place where most people spend the majority of their working day. So undoubtedly, the workplace is an important context for health and well-being. And therefore, employers, whether they realize it or not, are playing an important role as guardians of the environment in which people's health and well-being is manifested. And it's true that, that health and well-being has a material impact and interest to organisations, because people who aren't well, and there's lots of studies, many done, showing that anything up to 70% of employees turn up to work not firing on 4 cylinders, maybe 2 or 3, because they're tired, they're stressed, they're ill, they've got back pain. This has a material interest for employers because it has such a huge impact on the total productivity and engagement of the workforce. And you're right to point out that, is this something that the employers should take responsibility on and look to get involved in terms of how might they support and nourish the well-being of their staff? And I think there's quite a lot of evidence to suggest it's in their material interest to do this. And there is a shared, if you like, a contract that would need to be evolved and developed, which is partly the responsibility of the organisation to create an environment where health and well-being can flourish. But there's also a responsibility for the individual to take some ownership for their own health and well-being within that. So there are, as we know, a lot of health and well-being schemes at the moment, some better than others, but one would argue that overall it's not really moving the dial as much as we'd all want. So I think in this future there is a real opportunity for employers to up their game, and for that new relationship between employers and their employees to be developed to the next level, built around an acknowledgement and realisation that health and well-being is an incredibly important part of the work environment.
It's been suggested that employers understand the problem, but is it true, do you think, that they don't really understand the true costs of not actually taking the full responsibility, given that many of the costs are actually externalised to the public health system and to the individual employee? And the data shows that actually most of the costs of the problems caused by the workplace are not met by the company. Only about 20% of the costs associated with healthcare problems are actually addressed by the people who are arguably causing the problem.
I think that's fair to say, and I think there's an interesting moment in history at the moment where organisations are having to reflect on how they account for what they do, the resources they spend. And we've come from sort of an era where the spreadsheet rules, the numbers rule, and there's, through that prism, through that frame, there's a sense in which the health and well-being of the staff matters in so much if people are absent or there's a direct impact on the ability to perform. I think what we're seeing is a greater sense and awareness that there's a huge indirect benefit as well, that it's not just about direct costs. A healthier workforce, one in which the employer is seen to participate in cultivating that, is likely to yield a greater sense of engagement, greater levels of well-being, which then flow back into the organisation in terms of, as we talked about, greater engagement, but also greater productivity. And there's an opportunity for the organisation, if it thinks more holistically, to also think about health and well-being as another part of the relationship with it, to cultivate with employees that will support and aid retention. And we're moving to a world now where it's quite difficult to retain staff over the longer term, and knowledge and expertise will leave quite readily. So finding a way to use health and well-being not simply as a tool to drive improved productivity, but also nurture and cultivate the relationship with employees, I think would be a much more inspired and enlightened way forward. And I think we're starting to see signs that some companies now understand that.
And in a knowledge economy, we need to also think about health not just in terms of physical health, but mental health as well. And in a knowledge economy, mental health obviously has an even bigger impact on productivity and motivation and engagement and so on. Absolutely.
And across the healthcare system, it's often said that mental health is the sort of Cinderella. Physical health has received much of the attention. But there's huge amounts of research to show that a lot of the poor health behaviours that lead to poor physical health have their origins in mental health. Stress, anxiety caused by insecurity often leads people to self-medicate with food and drinks and substances that then could lead people into a spiral that then leads to poor health. And one of the interesting and quite dramatic stats that are out there at the moment is that in any 1 year, 25% or a quarter of the population is likely to be in a state of mental health that would qualify as a clinical grade problem. So we have a huge challenge in our society at the moment about stress and anxiety, and a lot of that originates in the workplace itself. So mental health is a hugely important area that needs much more attention in the workplace, and employees need to grapple with that in a much more enlightened way.
The issue seems to be that employers manage to externalize costs, or costs are hidden. But is it true, you think, that actually the biggest cost is an opportunity cost, so the cost of value not added?
I think it's a very good point there, and we just talked about the impact of mental health and the role of stress. There's some really interesting studies about what does stress actually cause rather than just increase levels of cortisol and anxiety. What it also does is reduce people's ability to think laterally, to think more holistically, take on other perspectives. And as we see the nature of business transform itself in the 21st century, increased levels of competition, increased levels of technology requiring more adaptive, fast-moving, more fluid types of responses from businesses, there is a need for knowledge workers to work more effectively in teams, collaborating, solving new problems more quickly. So having high levels of stress in management and in the workforce is going to make that more difficult. So there's a huge opportunity cost, both within the ability for the organisation to take the intellectual resources of its employees to deploy that to transform itself and compete more effectively. But there is also a downstream cost of course, of poor health and well-being, leading to less engaged workers who are less productive, who are sick more often. And this is an area that businesses need to look at more holistically. The health and well-being of their employees is a resource that could nourish their own business models if they were to think of this as an investment and not simply a cost.
So I guess in the questions I've asked, I've been stressing the issue of cost, but actually there is also an opportunity. So you mentioned companies would do well to get ahead of the game.
Yes, absolutely.
And there is potentially competitive advantage in order, to be had by getting their act together.
Absolutely. As anyone who's working in business now realizes, there is a changing consciousness, but in both employees and in the customers of organizations themselves. There is a growing awareness that people aren't just objects to be used to extract their labor for minimum cost and maximum profit. There is very much a sense that people want to be treated with respect. They want to be looked after, as well as having an opportunity to contribute to the financial well-being of the firm. So this new, if you like, a sort of social contract between the organization and its employees and society is becoming much more relevant, much more real, and therefore there is in order for an organization to be successful in the future, those that are able to embrace that and encourage and create a new, much more productive and enlightened relationship with their staff are the ones that are likely to attract and keep the best talent and be able to get the most from their staff. And all of those factors, I think, are going to be absolutely fundamental to firms that are most successful in the future versus those who are not.
I suppose the most simple way of actually looking at this, if companies really do believe that their employees are their most valuable assets, then they are going to look after their health. And that doesn't mean just encouraging them to behave more differently. It does mean creating less stressful workplaces and managing the prevention rather than
Yes.
consequences.
Yes, and this is an overarching theme, I think, within the report. There's a sense in which health has been, National Health Service is more like a national sickness service, the sense that we react to poor health rather than create the environments that allow people to flourish and are preventative, and really see the agenda needing to shift to a much more preventative mindset. A, because you get better, healthier, more productive people from the perspective of organizations, but B, because it actually reduces the amount of sickness. So this reactive mode needs to shift to more preventative mode, and there are huge benefits that go beyond that from thinking in this much more holistic way.
Thinking in terms of a social contract, one of the points that Pfeffer makes in his book is that individuals ought to become more aware of the way in which their employer impacts on their health, and actually be more careful in choosing where they work. So if that happens, then this relates also to the issue of the employer brand.
Yes. So one of the things we outline in the report is that the breakthroughs in understanding of what is health and how health is manifest in the body, what are the causes of health and well-being, stress and flourishing, as we start to unpack and understand what contributing factors actually contribute to that and be able to measure it, there's going to be a greater awareness in individuals about what it is that will lead to their health and well-being, and a greater understanding and awareness from firms about what type of management practices and environments lead to poorer or better health outcomes. So that we will enter, I think, a world of greater knowledge and understanding. That means that both sides will have a much more enhanced understanding of, from an employee's point of view, what kind of environments will they want to work in given the new knowledge they have about what contributes to their health and well-being. And organizations will have new knowledge with which to reflect and think about what kind of organization they want to be and what kind of environment they want to offer to attract the best employees.
So we've actually called the conference that we're running New Order Healthcare. It sounds like it really is a new order. The power and with the information provides is shifting roles and responsibilities around the whole system. And that's what I'm kind of referring to when I talk about new order. It really is a transformational change. Would you agree?
I do agree. I mean, the whole basis of this report was we can incrementally move forward from where we are now. But what we're likely to do in taking that incremental mindset is take our existing ways of thinking and augment them slightly, step by step. What's called for, what's coming, if you like, is a radical new set of understanding and technologies and data to which to understand health and well-being much more holistically and much more depth. And it would be beneficial for all actors involved in this enterprise of supporting people to flourish. And in that definition of flourishing, it's not just avoidance of sickness, but through a work lens, it's about people being able to contribute more fully and more productively into the workplace. It's to get ahead of the game, to see what is coming, to understand that is an incredibly important contribution to their overall success in the longer term, and start to plan for that future. It's coming. Get ahead of the game. And as you rightly say, does reflect a new order, a new way of thinking about
but we
people.
shouldn't be worried about the change that's ahead. There is going to be some disruption, but we should actually focus on the opportunity that's going to come from it. And you're trying to create a vision so that people have more clarity and feel more confident in the benefits of all these innovations that we're talking about. Is that?
Yes, I mean, one could crystallize this down in that everything I've been talking about is really reflecting that we need to move towards a much more human-centered way of thinking about work and business. And as we understand what it means to be more human-centered and all the aspects that flow from that in terms of poor health and good health and flourishing, more human-centered businesses are going to be the most attractive places to work. They're going to have people who are flourishing and able to contribute most to those organizations. This is a direction of travel that I think the whole of society is recognizing and moving towards. So grasp that opportunity. It is a new order. Get ahead of the game. Think about what that could contribute and start putting in place the structure, the thinking, the policies that pull through this new world so that you're prepared for it.
And finally, the report was looking at the UK particularly, but everything that's in the report really has got global relevance.
Absolutely. Every single country in the world is facing the same challenge. Certainly in the developed nations, there is an aging population. There are greater levels of things like obesity, stress and chronic disease. There's more medications coming through. There's a burgeoning there's almost a crisis in every healthcare system. So what we've articulated today, which we've largely focused on the UK as the initial frame, is absolutely the same challenge elsewhere in the world. And what we've done through this report is really set out a challenge to the UK policymakers and healthcare system to say, if we grasp this long-term future and understand where things are going and start to build for that, we have an opportunity in the UK to build the world's best health and well-being platform, if you like, which is a combination of official public health, but also getting getting other actors to come in and join in to propagate and push forward increased levels of well-being and health across the population. If we can get an ecosystem approach to addressing the long-term health of the nation, this is a formula that's going to be incredibly powerful around the world. This is a multi-trillion-dollar market here.
And those that you engaged in the research and the people that have had early sight of the findings of the report have provided you with overwhelmingly positive feedback, yeah?
Absolutely. It's very rare that you walk into a number of meetings with senior politicians and stakeholders from across the landscape in which within 5 or 10 minutes people are absolutely thrilled. There's a sense that this all makes sense. It makes sense. No one's been thinking in this sort of 10 to 15 year frame and trying to bring all these things together. So in some ways, there's a simplicity in bringing it together that just makes sense. And there's a real excitement around the healthcare and other business leaders we've showed this to, that yes, this is the future. How might we therefore start to understand this and reflect that in our long-term thinking? Because it is the way forward. And if we can reach across our different silos and industry sectors to start to think in this more holistic way, everyone is going to benefit. It's a tide that will raise all boats if we can coordinate our thinking around this long-term aim.
Okay, so healthcare beyond the fog is a very positive place to be.
Yes, absolutely.
Okay, thanks very much.
Thanks very much indeed.